Welcome to Season 4 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Commissioner of Health in Baltimore City. Our goal is to bring scientific evidence and experience to current topics in public health through engaging interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, let's talk about voting. I speak to Dr. Alistair Martin, an emergency department physician at the Massachusetts General Hospital and the founder and executive director of Vote ER, an organization at the crossroads of health and civic engagement. Let's listen. Dr. Martin, thank you so much for coming to the podcast. Tell me, what is Vote ER?
Thank you for having me, Dr. Sharfstein. Vote ER is an organization that exists at the intersection between health and voting. And it does so to help our patients and our providers and colleagues vote like their health depends on it, because it does. Vote ER started from the simple premise that in this country, we have over 50 million people who are not registered to vote, but who are eligible. And when you look at the demographic data, when you look at who the folks are that make up that 50 million, that's a whole country's worth of people who are not part of the political process. When you look at the demographic data, the folks who are often not registered to vote, but eligible, are the same exact folks who are our most vulnerable patients, folks who are most marginalized by our healthcare system. Both groups end up being younger. They end up being more likely than not people of color, and they tend to be lower income. And so the idea is fairly straightforward. When we're looking for these 50 million folks who are not registered but eligible voters, many of them are in our waiting rooms, in ERs and community health centers and federally qualified health clinics. And what Vote ER does is it makes it easy for healthcare providers, for health settings, for hospitals, for clinics, to help patients register to vote. For many of them, the first time they've ever registered to vote. And we do that in a way that's nonpartisan, non-interruptive, and non-coercive. And over the course of the last election, we helped just over 50,000 people with voter registration or the mail-in ballot process. And so we're just getting started.
That's great to hear. I wonder, from the patient's perspective, how does Vote ER work? Like, if I walk into an emergency room that is a participating emergency room, is that how it works? Then what would I see differently?
Well, what's so interesting about this? We started in ERs, but where we are now, actually, I want the listeners to sort of venture a guess as to what specialty might be the most represented among the 25,000 Vote ER users. And it turns out it's not ER docs. It turns out the first number one specialty that is most represented by, physicians that are helping to get their patients registered to vote are pediatricians, and then family medicine docs, and then ER. So, if you are a patient walking into a family practice clinic, what you might see in that clinic that's working with Vote ER is two of the following things. Number one, what you might see is you're sitting in the waiting room and you look up, and as you do, you see a huge poster that invites you to take 90 seconds to check your voter registration or to get registered to vote while you're there. And it's done with a text message code. So all of the voter registration happens right on your own phone, and you can do so, whenever you want. The next thing you might see is when the doctor brings you back into the examination room, you might see the doctor wearing a lanyard. And I'm gonna show Dr. Sharfstein. I know the listeners can't see this, but I'll try to explain it. It's a lanyard that has very, very boldly and obviously on it the words "ready to vote" on the lanyard. That "ready to vote" is really just a call to action. It's a visual trigger that then allows the healthcare provider to, if a patient asks, hey, doc, why does your lanyard say ready to vote on it? The healthcare provider can say, well, it says ready to vote because I want you to take 30 seconds here, just check your voter registration. And they point down to a badge that all healthcare providers who use VoteER have on their ID badge. It's an extra badge backer that has a QR code and a text message code that allows the patient to register to vote on their own phone. So these are some of the things that you might see if you were a patient in a place using VoteER.
Got it. And how many states are you working in now?
Yeah, all 50 states.
So you're firing on all cylinders, trying to get people registered. And I wonder what the response from patients has been. It's not a typical thing at a doctor's office to be asked about your registration status to vote. Do patients react well to this? Do you have, talking points for doctors if patients get upset or object or anything like that?
Well, I'll tell you a quick story, Dr. Sharfstein. So last election cycle, I was taking care of an elderly man who had multiple myeloma. And he was on chemotherapeutic agents and was immunosuppressed. And it was maybe about a month and a half before the election. And, we got through our whole, physical exam and moved on to, I was going to leave the room to go to another patient. I said, oh, and by the way, do you plan on voting this year? He said, yeah, of course I do. I always vote. I said, how do you plan on voting? You plan on, sort of going in person? You plan on, sitting in a mail-in ballot? He said, well, doc, I haven't thought about that, but I planned on going in person. And I said, well, at the end of the day, you're free to choose whatever method you want to vote. But what I recommend as your doc is, given your immunocompromised status, given that we're in the middle of a pandemic, I recommend you vote from home this year. Do you have a mail-in ballot? And he said, no, I don't. And so I said, no problem. I showed him my badge backer. I said, here's my QR code. You can scan this right now. And in the next minute, you can get yourself a mail-in ballot to vote from home this year. And he looked at me. I will never forget the look of wonder and surprise in his eyes. And he said, wait a minute, you guys do this too? And there was this I don't know, like him feeling as if he were seen in a new way that I've seen consistently when I talk to patients about voting. It's like sort of acknowledging this other part of their individualism or humanity, that you're a patient, but you're also a participant in this thing that we call democracy. And we're seeing that happen all across the country. And the data is pretty interesting when you look at it. There was a very interesting study that was done back in the early 2000s. Community Health Center out in Brooklyn or in the Bronx did a pretty wide scale voter registration effort. And after they did so, they surveyed patients. And over 90% of them, when asked, hey, how did you feel about your doctor talking to you about voter registration? Over 90% of them actually welcomed and encouraged it.
So it's practical to do, doesn't take much time, and patients on the whole seem very open to the idea. You said at the beginning that people should vote like their health depends on it, I think. Tell me about your motivation for setting up something like this. And in what sense do you think that voting and health are linked together?
I was taking care of a patient just this past holiday. I think it was maybe Christmas Eve or the night before Christmas Eve. And I had a young woman come into the hospital with abdominal pain. She was maybe in her early 20s. And she came with her elderly father. He had Parkinson's disease. And it might have been 1 or 2 a.m. in the morning. And so, Dr. Sharfstein, when you're getting a story and a physical exam that's just not suggestive of any particular diagnosis, or you feel like you're missing something's not being said in the history, you can just kind of pick up on it. And that's the feeling that I had in the room with this young woman. And so, she tells me about her abdominal pain, but there's not many leads, and the exam wasn't super conclusive. And so, I was thinking to myself, well, we got to test it for everything. We got to, make sure she doesn't have UTI, rule her out for cholecystitis, et cetera. And so we send all these labs, and, it turns out she didn't have a UTI. She didn't have cholecystitis. Turns out she was in starvation ketosis. She was in the emergency room with abdominal pain because she hadn't eaten. And I went back and I talked to her and I said, look, it looks like what we found is that, you haven't been eating. Is everything okay? And this is when she told me, well, yeah, I'm embarrassed to say this, but my dad has medications that are really expensive. And I lost my second job, the job that I work on the weekends. And I've had to make a decision over the course of the last couple of weeks. Do I pay for his copay for his medications, or do I eat? And there's no surgery I'm going to do to solve her problem, right? There's no prescription I'm going to write that's going to solve her problem. I can't solve her problem by doing a central line or an ultrasound. She can solve her problem by voting. We can solve her problem by voting. And so it's not until we get our most marginalized patients involved in the democratic process and have them sit at the table and help to decide what we're going to do in this country to make things a little more fair, to make our healthcare policy system work in a more just way. It's not until we do that we'll have a truly fair and equitable healthcare system.
Thank you for telling me that story. What a incredibly difficult situation. It sounds like you want people to be able to talk about the problems that they have and engage in the problems that they have, but you're not prescribing a particular solution with this effort. Is that fair?
Yeah, that's right. That's right. That's exactly right. I think at the end of the day, this isn't about a specific candidate. It's not a specific policy position. It literally is just about helping people register to vote and then vote, because we know from the way that our political system is set up, for any of the listeners who have worked on political campaigns, presidential campaigns or senatorial campaigns, or maybe you've helped someone run for mayor, you know that at the end of the day, there are only so many hours in a day and there are only so many dollars in the account. And so when you're thinking about whose door to knock on, whose phone to call, which emails to send, where to deploy volunteers, these candidates are trying to make decisions around who is most likely to actually vote. And unfortunately, if patients are not voting or they don't have a voting history, they are just not interacted with. They're not engaged with. Their perspective is not listened to. The issues and priorities and questions that are on the minds of the people of these neighborhoods are just not incorporated. And so what happens is, unfortunately, when those folks are elected, they often feel no real responsibility, and also don't really know much about the most vulnerable folks to help them in the first place. So we've got to break that cycle by just helping people vote and getting them registered is the first step.
So if people are listening and maybe they are working at clinics or they are healthcare providers themselves, how can they join this program?
Yeah, it's a great question. So we make it really easy. First of all, it's free, and it always will be free. We create Healthy Democracy Kits, which are the lanyard that I mentioned previously. It's got the ready to vote signage on it. And then a badge backer that affixes to your badge, your ID, and allows you to, when a patient asks you, or when you want to bring it up with a patient, very easily triage people to the lanyard, to the badge backer. They register to vote on their own phone. You don't have to be an expert in voter registration. I am not an expert in voter registration. We've got a team of folks who are on call 24/7 to walk people through if they get stuck. You don't even need a driver's license. You can do, voter registration if you don't have, depending on your state, you can do it online if you don't have a driver's license, which is a very important thing, by the way. And so we have 25,000 physicians and nurses and social workers who wear these kits every single day to work. Just yesterday, I worked a shift in the ER and saw someone I'd never met at my hospital walking out of the hospital with one of these lanyards. And I don't think she knows who I am. But it's been a really beautiful thing to see healthcare providers step up now more than ever to help their patients vote like their health depends on it.
So what is the website people would go to sign up?
Yeah, so the website is vot-er.org/kit. vot-er.org/kit. And you can put an order in for one of these Healthy Democracy kits, and it'll be there within 3 or 4 weeks.
Got it. Well, thank you so much for joining me today. I have to tell you, though, I'm not surprised that pediatricians are the ones that are the most enrolled in the program as a pediatrician myself. But I do appreciate that there are other physicians and other healthcare providers who are deeply involved in this. And I really want to thank you for the work that you do. And I hope that this has been of great interest to our listeners as much as it has been for me. Thanks.
Thanks so much, Dr. Sharfstein.
Public Health On Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.